All right, it looks like we have about 18 folks on so far today. So thanks so much for making the time to join on this chilly day. I hope everyone's fall is off to a great start. If you wouldn't mind going ahead and putting your name and clinic in the chat as always, so we can see who we have represented today, especially as we have some guest presenters who would love to see everyone who's joining as well. And if you would also add what your favorite pie or dessert is for this fall winter season, would love to hear about that as well. So as you all know, I'm Elsa Weltzine, Program Manager for CCSP. And my favorite pie all year round, even though it's not very wintry, is key lime pie. So today, as everyone's putting that info in the chat, I'm going to pull up a couple of slides for our announcements, and then we're thrilled to have Christy Cahill joining us from the Colorado Cancer Coalition, and Ian Kahn joining us from the Colorectal Cancer Task Force through the coalition today to present on some of the efforts and opportunities happening and how you all could engage with the coalition. So I'm going to go ahead and share my screen. All right, so great to see few people putting their info in the chat. Go ahead and add that in if you haven't already. Seeing a few votes for pecan pie, a few for some fruit pies, and pumpkin pie, the classics. So go ahead and put your vote in and we'll see what everyone's favorite dessert is. Today, I just wanted to give a couple of updates and reminders for CCSP programming, and then some other opportunities that we'll also be sending out in the follow-up notes. And then, as I mentioned, turning it over to Christy and Ian, really for the bulk of our time today. And please, of course, engage with us in the chat as we go through everything and let us know if there's any questions you have at any time. Just a quick reminder again about our capacity building opportunities for this year of CCSP funding. So we still have the opportunity to fund several more clinic systems to help build capacity for stool-based testing efforts, lung cancer screening, and genetics and family history assessment. Thanks to the clinics already who've sent in your interest form of what you would be interested in focusing on as a goal, and a couple activities to help bolster one or more of these areas. As a reminder, it doesn't have to be full implementation of any of these strategies. We really just want to meet you where you're at and help support the work you're already doing and grow and strengthen these efforts. So I'll be sending out again the interest form again, or please reach out to us if you want to discuss your ideas further. And we'll be following up to those we haven't heard from yet, just to see what you might be considering and where you all are at. But we definitely have the opportunity to fund most clinic sites or most clinic systems to do one or more of these areas. And knowing that many of you all are already implementing stool-based testing. We'll also be having a couple informational meetings coming up about the opportunity for the genetic counseling and testing work with Ambry Genetics as our new partner, and then lung cancer screening efforts as well. So stay tuned for that. And then I also just wanted to remind you all that I've sent out a couple of notes in the past that right now CCPD is going through their strategic planning process to inform what the strategies will be for the next funding cycle that will start in FY24. And so right now they're collecting surveys for each of the disease areas that are funded through CCPD. And they really want to get input from all the stakeholders and partners. So Please fill out the surveys if that's something you have an idea of what you really want to see for strategies for how this funding is used going forward. Reminder that for CCSP, we'd have to reapply for our funding as well. And so there's a specific survey for cancer, as well as for social determinants of health, healthy eating and active living, cardiovascular disease and diabetes, and then pulmonary disease. So I have all of those surveys linked, and there's a couple presentations. There's a presentation as well that what those priorities are in the chronic disease state plan that's aligned with the CCPD funding. And then just a couple reminders of events we have coming up. So our CCSP specific interpreting endoscopy and pathology reports webinar is next week on Tuesday, November 16th, or in 2 weeks on November 16th at 11:30 a.m. with Jen Kolb returning again to do a review of those key aspects to know about on endoscopy and pathology reports, what you need to know for CCSP evaluation reporting, as well as just those key things to know when you're looking at those reports for navigation of your patients following their colonoscopy. So please register so we know how many people are coming. And I've sent out a calendar invite to all of you as well, and hope to see you there. We've definitely had this as our most requested topic this year. I'm going to skip on the coalition events, but those are linked here because I think Christy will be telling us a little bit more about those, but those are coming up this week as well. And then our December monthly call will be focused on stool-based testing workflow examples. And then also launching in December, we have our sustainability planning webinar series for this year, where we're thrilled to be joined by the Washington University and St. Louis team to be talking a little bit more, taking a step back to where our sustainability planning framework came from, how it can be used for many different situations beyond just CCSP and other programs it's been applied to, and how it can be used. So they love to have programs adapted for many uses beyond just CCSP. And then we'll be connecting with the regional health connectors in January, joining their monthly call. Hope you'll all join for that interactive workshop. And our second most requested training topic for this year, Bowel Prep. We will have that webinar in February, and that's been scheduled with Dr. Timothy Yen from CU joining us for that one. So that is all I have for announcements. Let me see if I missed anything in the chat. Some more votes for pumpkin pie, and fruit pies and pumpkin pie and pecan pie are all still very closely neck and neck for which one's the favorite. And Christy had an update as well for the lung cancer timing on Friday of that symposium. But I'm going to turn it over to Christy now to share a little bit more about what's happening with the Colorado Cancer Coalition.
Thank you, Elsa, and thank you for having me here again today to talk all about the coalition and how everybody can engage. Are my slides coming through okay?
Yes.
Okay, I have way too many slides because I could not decide what content to eliminate because there's just so many different ways you can engage. So I'm going to try to go very fast to keep us on time. But we just launched our new cancer plan. And so I wanted to share how it guides statewide collaboration to help eliminate the burden of cancer in Colorado. So in a state where 23 people die a day from cancer, and in a state where cancer is the leading cause of death, how do we work together to prevent cancer, find it earlier, treat it better, and improve the quality of lives for survivors? And so, one of those ways is all the great work you are doing, trying to get people in and get them screened early and on time. And then we also have the coalition, which is that convening ground to provide education, networking, best practice sharing, and partnership opportunities for those working in oncology care and support. And then beyond the education and networking, we also have some resources on our website to help connect patients and their caregivers to opportunities to advocate for better cancer outcomes in Colorado. So I mentioned briefly that we just launched our cancer plan, and we're on our 6th iteration. It's the vetted roadmap to eliminating the burden of cancer in Colorado. It is evidence-based, it's data-driven. It comes together, some of you probably actually helped with some of the strategies, but it comes together with subject matter experts from all across the state who come to the table to share priorities and their expertise on what we should really be prioritizing in the state. There's the link to it there. So I'm going to quickly go through the goals, and I'm going to spend a little bit more time on ones that are relevant to family history, lung cancer, and colorectal cancer. So the goal 1 is about decreasing tobacco use, and that focuses on not having people start, focuses on decreasing exposure to secondhand smoke, and promoting quitting attempts. So I just wanted to put these here, and I'll make sure Elsa gets these slides, but there's lots of different data sources. If you're ever looking for data, if you need to, if somebody has a question around, well, why are you focusing on that, or why are you doing that? There's lots of different data sources, and I'm always happy to help you track down data sources as well. So these are linked here, where you can find data by county level on who smokes, how often, that type of thing. And then ways that you can engage on this goal, we have a lung cancer task force. There are also statewide tobacco coalitions. There's the quit line where you can refer people to. And then, there's a lot of stigma around lung cancer. And so having conversations around getting rid of that stigma. I don't know how many of you have heard of the White Ribbon Project, but they actually exist to help decrease that stigma around lung cancer. One of their kind of mottos is anybody with lungs can get cancer. And so nobody should feel ashamed for having a cancer diagnosis. So I think definitely, changing how you talk about lung cancer is definitely something really important that you all can be on the front wave of changing those conversations. Goal 2 is the increased prevalence of healthy behaviors. And that one focuses more on the healthy eating, active living, like obesity, drinking, decreasing exposure to UV radiation. So I'm not going to touch on that one today. Goal 3 is the increased uptake of clinical interventions to prevent cancer. And so this one focuses on family history. So collecting that family history of cancer, making sure people are talking to their family, getting that cascade screening going once you do have a diagnosis in your family. And then also moves on to HPV and hepatitis B and hepatitis C. So with this one, there's lots of different ways you can get involved. Educate your patients to know and share their family history of cancer. Develop cascade cancer risk screening programs for family members of patients. And then for some of the other areas, which maybe aren't as quite relevant, the motivational interviewing to increase vaccine uptake. We have an HPV task force that works on that. We have the survivorship and palliative care task force where we can share family history resources. And then we have the colorectal cancer task force, which you'll hear more from later from Ian. And then we're bringing back the breast cancer task force. And so both of those task forces, the family history conversation is very important. Goal 4 is the decreased environmental exposures that lead to cancer. So this one works on radon, drinking water wells, asbestos, and diesel exhaust. And so I wanted to highlight a few of the radon resources available to you to share with your clients. So the CDPHE has a really great tracker on their website where you can find environmental exposures. And so you can actually look for radon, well water, occupational health hazards. And so that's linked there for you. Then ways to get involved with this piece, you can help inform cancer plan implementation, So help us figure out which strategies to work on. You can join the Lung Cancer Task Force has a radon work group. And most of you probably know that Colorado has pretty high levels of radon compared to other states. And so making sure that people are getting their homes tested if they have high levels of radon, getting them access to the low income radon mitigation assistance program. And so those two things are linked here for you as well, for you to share with your clients. Goal 5, so goals 1 through 4 were all on prevention, and goal 5 we move into the early detection and screening. And so this is your wheelhouse where you all work. So we have 3 goals here, and that one focuses on average risk individuals, getting them in for their cancer screenings, and then the next focuses on priority populations, so the rural, frontier, low, underinsured, uninsured, and then we also have a section on non-screenable cancers. So again, here's a data source. You can search to see BRFIS, the Behavioral Risk Factors Surveillance Survey. You can search that to see how up to date we all are with screening, and I'm sure Elsa shares these stats with you all on an annual or more so basis. But ways you can get involved with the cancer screening goal. So we have, we just are bringing back the navigation task force. I mentioned the breast cancer task force. We have the colorectal cancer task force, the lung cancer task force, the skin cancer task force, and an HPV vaccination task force. So these all those task forces work on screening in some way, shape, or form. Some other things you can do is promote informed decision-making. So have those conversations about their risk levels and what they should be screened for. Implement client reminders and provider reminders and recall systems. Host culturally relevant educational events on cancer screenings, and help reduce those structural barriers to cancer screening. So this, you all know this part, but just wanted to make sure to highlight that here on this part. Then goal 6, we move on to 6 and 7, move on to diagnosis and treatment. And so this is making sure that all across Colorado, Coloradans can get consistent access to quality diagnostic and treatment services. So quality is the key word there, making sure that no matter where they are, they're getting the best care that they can get. And so this one looks at shared decision-making, reducing financial barriers, reducing geographic barriers, and then also increasing testing with increasing access to targeted, proven, and emerging therapies. So as either new screenings come out or new biomarkers for treatment come out, ensuring that they're getting access to the best care possible for the best outcomes. So some ways to get involved here, that we have a treatment and clinical trials task force. That's a new one. And that's getting off the ground now. So that's one way. Again, we have the navigation task force. If you work with anybody on the treatment side, we have a biomarker survey out right now to examine what the barriers are to biomarker testing in Colorado, and why patients aren't accessing it as much as they have the availability to. Get patients connected to a financial counselor or navigator once they get that diagnosis. There's a program, financial toxicity training, that can walk you through how to maximize insurance benefits and really try to get to solve problems before they go down the bankruptcy, get into bankruptcy. And then again, promoting informed decision-making, and also educating patients about biomarkers if necessary. So goal 7 moves on to clinical trials. And I'm going to skip over that. Goal 8 moves into survivorship, and it's the whole body. So physical, mental, emotional, behavioral, and financial well-being among people affected by cancer. And then goal 9 is increasing patient engagement and health literacy. So this is, trying to get get patients more access to health navigators and community health workers along the entire cancer care continuum. So more screening navigators, more treatment navigators, more survivorship navigators to really be there the entire step of the way. Also, just overall trying to help Coloradans understand general health and medical insurance information. And again, that patient-centered decision-making so that they feel empowered in their care and can be an active participant in the decisions that they're making. So this last one, the navigation task force will be working on this. You can promote informed decision-making among your clients, and as well just recruit more people to the workforce. You all know we need more navigators to really be able to meet the needs of Coloradans because, you know, I started with those stats, about 23 people a day dying from cancer in Colorado. You know, if we had more navigators, I bet that number would go down quickly over time if we had more people in this workforce. So let me just see a chat. Okay, it's Elsa. I'm going to go through just a few examples of other resources we have, and then other ways we've been doing cancer plan implementation so that you can see what it looks like to be involved in the coalition. So I mentioned all the different task forces you can join. We also have a list on our website of support groups if you do have clients that are then diagnosed and then need to find support. There's also this cancer resource map to help patients find resources in their part of the state, so they're not having to drive forever. You can encourage physical activity. You can get, once someone's diagnosed, there's a mental health support program from Ray of Hope. And then, you know, palliative care is super important. So that's one thing you can educate clients on, as well as making sure they have their health directives and their advanced directives. I have one more slide on ways to get involved. So we do have an email list, and we send out a ton of resources on a monthly, sometimes more than monthly basis. We'll send out funding opportunities, job opportunities, articles of interest, lots of webinars of interest that we host or that we see other people hosting that we think would be relevant for the oncology community in Colorado. Our task forces have opportunities for guest speakers. So if there's a topic that you're, you know, passionate about that you wanted to share at a colorectal cancer task force meeting, or you had a case study, or, you know, if you had something that would be of interest to task forces, we're always happy to look at that for a task force meeting. We host different educational events throughout the year, and I've worked with Andy and Elsa before to bring some of you in to share case studies. So that's another opportunity as well. We do the occasional policy work. And so if you want to provide testimony on a bill or share just a story for why this bill would be important for your community, that's always an opportunity. We do some social media campaigns around World Cancer Day and Healthcare Decision Day. And so I reach out to ask for people's stories and photos and really just elevate the conversation on those 2 days out of the year. And then Elsa had mentioned these earlier. We have our mini symposium on November 5th. And I'm really excited, we have Lisa Richardson from the CDC on our panel. And so we're really going to be talking about the cancer plan and how we can put it into action and make sure that we're looking at everything we do through a health equity lens and addressing social determinants of health. And then also on the 5th, we have the Colorado Collaborative on Lung Cancer Screening Symposium. And this is our second annual year for that. The Lung Cancer Task Force has been really active in getting this collaborative going so that we have a place to share best practices, learn from each other. So we're not all reinventing the wheel as lung cancer begins to get more uptake. So if you are interested in that, the lung cancer screening piece and implementing that, I would highly encourage you to come to the collaborative on November 5th and 12th. And really the possibilities are endless in how you can engage with the coalition. Elsa, do I have time for a few more slides?
Yes.
Okay. So now I just want to move to just a few examples of work we've done. So this map here is age-adjusted incidence rate for 2018. And then this is age-adjusted mortality rate. And so we looked at the incidence map and the mortality map. And because we it had a high incidence rate, and we had some connections in Cheyenne County from Andy. We prioritized Cheyenne County to do our Coalition and Communities campaign. And so we've been talking with Cheyenne County for over a year now on cancer prevention and early detection, and listening to what they need in the community. We brought the Sun Bus out, and it was an amazing event. We did it when they were having their county fair, and so there were a lot more people around than would have normally been. And they did skin checks on the bus. They didn't have. There were so many people that wanted their skin checked, so we had to use the reveal imager as well, just to show people sun damage. It's not a true skin check, but it shows that sun damage. And we saw behavior change on the spot. People were buying sunscreen, buying the hats, buying the SPF clothing because they saw the sun damage, and they were like, oh man, I really should do something about that. So we've been having those conversations. We helped out at their hospital week, really just trying to infuse cancer prevention and cancer awareness and screening messaging into the community so that they can have better outcomes when it comes to cancer in their community. Ian will share about things, but I wanted to brag a little bit about the Colorectal Cancer Task Force because they've just done such great work over the years. They've done different call to actions based on different national campaigns. We did a text messaging campaign a few years ago with evidence-based messaging to try to the text campaign would lead them to a CCSP navigator to try and schedule that screening. They do different March Awareness Month activities by getting lights lit up blue, and the governor does a proclamation and a vigil and things. So they're a super active task force. So if you've not been to a colorectal cancer task force meeting, I would encourage you to go to one, but I'll let Ian talk more in a bit. This is another campaign we've been doing in kind of Southeast Colorado with basically the general call to action that takes them to the map to then try to find a place where they can get a screening. So we did one for colorectal, one for Cancer Prevention Month, one for skin cancer, and then we're working on a lung cancer version right now. And so these I can kind of target to different demographics based on whatever the cancer type is. So even the lung cancer one, we are targeting it to people who have smoked so that they can then have a conversation with their doctor to see if they're eligible for lung cancer screening. This is the cancer resource map that's linked earlier in the slides. This is just an example of the social media campaigns that we've done. So if you want to share your story, I'll be sure to tell Elsa when I'm collecting these so you can send in your picture and some of your statements for why you do the work you do. So again, I just wanted to end with this question of how do we work together to improve the quality of life for Coloradans? I'm going to skip over these. Alone, we can do so little, but together we can do so much. And if you have any questions, there's my email. I'll put it into the chat. Also, did we want to do questions now or wait till after Ian goes?
We can do a question or two now. I'm not seeing any in the chat, but I did want to see if maybe you could elaborate just briefly, Christy, on if people are interested in finding out what the different task forces are currently working on, what organizations are a part of them, where they can find that information on the Cancer Coalition's website. And then also if you could talk just briefly on what the new navigation or restarted navigation task force is focusing on.
Yeah. So I was going to try to pull up the website really quickly so I can show you where to go. So give me 1 second to pull that up. Okay, so if you go to the coalition's website, there is a task force tab here, and I'll just preface it with some of these pages need updating, and some of the newer task force pages aren't up yet. But if you click on colorectal cancer, you can see there's a list of the organizations that are involved. Again, a lot of these task force pages will need updates, but each task force is actually going through a strategic planning process right now. So I'll let Ian talk a little bit about what they've done. But the lung cancer task force has been focusing on really increasing screening uptake to really get, even though screening is new, like the rates in Colorado are lower compared to some other states. And so they're really looking at the data of like, where is screening happening? Where is it not happening? How can we then go to that community and bring them best practices and tools and bring lung cancer screening there? And then the navigation task force it'll be pretty broad again. So have cancer screening navigation focus, as well as post-diagnosis focus on navigating patients to cancer care and resources. So it'll be, again, sharing best practices. They'll bring in guest speakers for the navigation task force meetings. We'll work with the American Academy Oncology Nurse. I can't, AONN, can't think of what that stands for right now. But we're going to work closely with AONN as well as the Alliance again. And if you want to get connected to a task force, you can click on, there should be a join button on the page. And if there's not a join button on the page, you can send me an email and I can get you plugged in to the right task force. Sorry, our website's a little bit under construction right now. But I'm happy to have a conversation with you to connect you to where the right place would be. Elsa, did I answer all your questions?
Yes, Christy, thanks. That was great. The task forces are a super great opportunity to really meet people doing work all over the state. So it's a great way to work together on strategies. And so even if you're considering joining a task force, I'd definitely encourage you to just sign up for their emails so you can find out about the different work that's happening, some of the speakers they might have joining, and where they're really focusing efforts. So you can contribute that way as well, even if you aren't sure if you have the time to join officially. With that, I'm gonna turn it over to Ian to talk a little bit more about the colorectal cancer task force. But if you have any questions for Christy, please put them in the chat and we'll have some more time for questions at the end.
Yeah, can I just add one thing that I breezed through that slide? So yeah, one of the things I love about the task force is that the makeup of the task force is very diverse. So they're diverse in terms of both geography and roles. So there's nonprofit professionals, local public health professionals, industry, patients, caregivers, academia. And so it's really a great place to have those conversations and share best practices. And Ian can probably elaborate a little bit on that as well. Physician champions is another one. But they are just a great way to network and see what is going on in the state. All right, Ian, you're up.
Okay. Let me share my screen. You guys see that okay? Okay. All right. Thanks, Christy and Elsa. I'm Ian Kahn. I'm a co-chair of the Colorectal Cancer Task Force. The other co-chair is Sarah Roberts. She's with the CU, the Cancer Center. And my 9-to-5 job, I work at CDPHE in the Diabetes and Cardiovascular Disease Unit. And then I do this because I'm passionate about it. So let's talk about the CRC task force. Oh, it didn't go. There we go. So this is our mission statement. We're the only statewide group in Colorado that allows peer-to-peer engagement, learning, and collective action to support colorectal cancer initiatives throughout the continuum of care. And really worked hard to come up with this mission statement, as we really wanted to reflect what the members feel we are doing and trying to accomplish in the task force. So our task force, and Christy kind of alluded to it, and other task forces are structured differently. The way that ours works is we are made up of 3 work groups that focus on the cancer goals that Christy mentioned. And our task force is focused on 5.1 and 5.2, and that is screening and early detection for average risk and high risk and priority populations. And as she also mentioned, we are in the process of strategic planning. So this our next task force meeting is going to be the beginning of that. So if you do want to kind of guide the direction of this task force and what we're working on, I encourage you to either attend our task force or become a member of it, because there will also be an opportunity to participate via survey to help prioritize the strategies that we're working on. So right now we have 3 work groups. The first one that I'm going to talk about here is a provider support work group. And they are right now focusing on conducting a needs assessment to how to better support previously clinics that were previously part of CCSP. And clinics drop off of the program for many, many reasons. And so we're trying to see if there are a few clinics that we can support to work on communicating new screening guidelines, so starting at 45, and then enhancing, clinic screening rates. And this would just come with a little bit of technical assistance, and without the burden of reporting, for example. But this is one of our work groups that we're focused on is provider support. The next one is our CRC awareness work group, and at first it started off as a March awareness work group with just a focus on promoting colorectal cancer in March, which is Colorectal Cancer Awareness Month, and we realized that it needs to be a year-round thing. So there are a few ways that we are working on this. So Christy mentioned the coalition and communities, and so we work with the coalition and steering committee to coordinate these events. So when the Sun Bus is going somewhere, can we have someone from the task force or information about colorectal cancer screening to go out with those communities? The other thing that we're working on is social media and earned media to promote on-time screening, which is so important for that early detection. Then finally, we're collaborating with the Surgery Center of Fort Collins and a primary care doctor who is a member of the task force, who also does colonoscopies for his patients once a week. So we collaborated with them starting last March to deliver free colonoscopies to patients that had a positive stool test, but for whatever reason could not get a colonoscopy, whether it was transportation or timing or money, whatever the barrier was. We didn't ask, but we just wanted to provide with the colonoscopies. So we started that last March, and we just had another one in September, and we had nine colonoscopies to patients without insurance with a positive stool test, and it was just a really kind of special day. We got to talk with the patients to understand how this was helping them, and many of them flat out said that after a positive stool test, which how important it is to get a colonoscopy after that, without this program, they would not have gotten a colonoscopy. So we are planning to do another one in March, and would really love to expand this to beyond the Front Range. This took place in Fort Collins, as I mentioned. So if something like this interests you and you think that you can get a partner where you are to help with this, I'd love to talk to you. We kind of have a model now that is, we don't know if it's replicatable yet, but we would love to try it. The third work group is engaging employers. And so as I said, just because folks have insurance doesn't mean that they are up to date with their screening. And so working with employers to create a cancer screening friendly environment is one way to increase cancer screenings. And so over the course of about a year, we worked with members of this work group and also the Women's Wellness Connection program at CDPHE, because they too are also interested in employer screening, to create this employer toolkit to help guide, I hate the word toolkit, but really it is to help guide employers on what questions to ask their health plan or their benefits consultant. What are some promising practice? What are some evidence-based practices that we know work that other employers have implemented, et cetera. And so we also provide, the task force provides technical assistance to an employer walking them through this toolkit. Let's see. So we meet the second Thursday of the month at 7:30 a.m. Our meetings are typically an hour, 7:30 to 8:30, although the upcoming, this upcoming month on the 17th, I believe, we're going to be extending it a half hour to start the strategic planning process. And then the next few meetings will probably be a little bit longer because we want to make sure to take the time to plan accordingly. Because if we don't, we'll be all over the place, and that's kind of coalition life. So everyone is a volunteer that is working on the coalition, and we want to make sure that we utilize everyone's time efficiently and appropriately. So we do take this process seriously, and would love to have your involvement. Any questions, or Elsa, is there anything that I missed that you wanted me to touch on?
I think it was really great how you highlighted those pro bono screening days. We've heard from many of our clinic partners that they're always looking for colonoscopies for some of their uninsured individuals. So I would just like to reiterate that I would encourage everyone to get the info from the colorectal cancer task force if that's something you're interested in as a resource. And then also, if there's any questions people have about specific criteria for that, reaching out to Ian through the email, because we would, as Ian mentioned, love to get that out and get as many people screened as possible this year. But I don't have any specific questions right now, and Christy just put in the video from the last screening day. So everyone, if you have any specific questions, go ahead and put them in the chat again, and we can also take a moment now if people wanted to come off mute to ask a question as well. And Ian just put the email for the colorectal cancer task force in the chat. And I will be sending out both of their slides, the links they mentioned, their emails, and then the video from that screening day as well.
Well, thanks, Elsa.
Thank you. Thank you so much, both of you. I know people have a lot going on this time, and especially as looks like Colorado could have an elective procedure suspension period again, I know that people are very swamped, so I just wanted to thank everyone for making the time to join today. And the coalition is full of resources and really wants to make sure they're meeting the needs of the community. So if there's a specific thing you're looking for and not finding an answer on the website, I'd really encourage you to reach out to Christy and Ian. They're always willing to help clinic systems out and navigators, knowing that you all are working directly with our patient community. And thanks, Julie, for the shout out. Well, if we don't have any other questions, we can end a little bit early today and give everyone back about 10 minutes of their time. But I'll make sure to send out those resources to everyone later this week, as well as the recording from today's meeting in case some of your team members weren't able to make it.
Thank you,
So-
Elsa, for having us today.
Thanks, Christy, and thanks, Ian, and thanks again, everyone, for joining us. Take care.